often get asked about chiropractic and if it is for more than just neck or back pain. The answer is yes, and let me explain why. The brain is the organ that's going to control and coordinate everything in the body. Okay? Has two halves. We have a brainstem that comes down as it's going to make its way into the spinal column, basically. Now, the brainstem is for primitive things. The other areas are for reasoning and logic, etc. When we have that communication, in order for that brain to communicate to the body, it has to go through the spinal cord, which is located in between, in the center of the vertebra. Okay. And then in order to get the information out to the rest of the body, it talks with the nerves. If we have an interference to that nervous system, we start having dis-ease in the body. Dis-ease, when left long enough, turns into disease. So we may not see the effects of something right away. Now, if we have an interference to that system, we used to say bone out of place, putting pressure on a nerve. It's more a misalignment or an area gets stuck and it's not moving. That creates friction. Friction leads to inflammation, and inflammation is what typically puts pressure on those nerves. It's important because if we lose the function, everything in our body eventually is going to not communicate, and we don't have a way to correct anything that would be going on in our body. Most of the things are with a feedback loop, most of it negative, meaning if we make enough thyroid gland, that thyroid hormone, if we make enough of the gland, if the thyroid gland makes enough thyroid hormone, that hormone circulating through the blood is going to register in a receptor area, and it goes, oh, I have enough thyroid, I don't need to produce more right now. So it shuts itself off. If we don't have that communication, we don't shut ourselves off, and we can overproduce or underproduce things that we need. A lot of times people will ask about kids and chiropractic. Well, the birth process can be incredibly traumatizing to the body, both of mom and to baby. But babies, typically, if they have some sort of issue where the doctor is pulling on the neck, or they have a forceps or a vacuum extraction, then we will have issues potentially with the very upper neck. Dr. Abraham Taubin did a lot of research on how much pressure an OBGYN is actually going to typically pull with on a baby's head as they are in the delivery process. Now, he worked with babies that did not make it, that didn't survive fully the birth process or were stillborns. So he wanted to see how much pressure it would take to decapitate the baby. He found that 120 to 140 pounds of pressure is all that's required to decapitate the baby that's already passed. And he found that the average OBGYN is pulling with 120 pounds of pressure. So if the average OB is pulling at 90 to 120 pounds, and that's nothing for them, we could be causing some damage. The bones can actually separate as far as 1.5 inches to 2 inches, and the spinal cord on babies can only safely stretch about 0.5 inch. Big difference there. We can see a lot of problems. So that pulling can cause a lot of tension on the neck. What might we see in babies? We might see a baby that cannot nurse from both sides if they're breastfeeding, or can't take a bottle from both sides. They may see a flat spot that arises on their head because they're only resting in one position. They can't comfortably look over the other direction. We may see ear infections that are frequent, colicky babies, lots of different things that we will see in the littles. Now, just because we didn't have, trauma, you can have a natural birth and it's still traumatizing. Both my kids were born at home. There was no pushing or pulling on anything outside of me to get those babies out. Yet, one of my children had jaundice, and she was adjusted and had her billy blanket, and she snapped around quickly. My son, his pelvis liked to misalign, and he'd get really constipated. So I really liked that I knew how to adjust him. So you can see a variety of things. That dis-ease of that system can be anything. I have watched babies that have lost a lot of motor function, and they can't stand up, or they're not developing. the skill sets that they should when they hit their milestones. Lots of different things that we can see. So it's very important we keep that communication highway open so that the brain can talk to the body. The body is what does the healing. As doctors, we don't do the healing. Your body is amazing, and it just needs to not have a disruption in the function. And those bones that go out of place or a subluxation, those can cause a dysfunction. We may have muscular tensions that are putting pressure on the nerve outside of the spine, and those are problem areas too. So all of these things can be checked over with an examination. In offices, we may use our hands with very gentle pressure for children, or we may use an instrument where we can do a controlled impulse very gently on the baby. Lots of things that we can do, but it's important for anybody to get their spine checked because it's silent. We don't know that something is going on until it's reached a dis-ease into a disease state that would cause pain. So the dis-ease is something that we want to try to eliminate as quickly as possible. So we never know what miracles may happen when the body has the ability to function better on its own.